My name's Beth, and when I was 12 I was diagnosed with bipolar disorder type 2 rapid cycling with psychotic features. Bipolar disorder is characterised by extreme mood swings, be very depressed to very manic, especially for me, like having rapid cycling, it changes quite quickly. I'm pretty sure I was actually depressed when I was about 9 years old, and every day at primary school I used to just, at lunchtime I spend the whole lunch hour sitting on the field on my own and I wouldn't speak to anyone, and I'd feel really low. When I was 9 I would talk about suicide and stuff, and it would upset my parents a lot. And then it got worse when I started high school when I was 11, because I got bullied, so that brought on a lot of stuff, and that's when I started experiencing the more psychotic symptoms as well. When I was diagnosed with bipolar disorder I was relieved, because it felt like the way I felt finally made sense. Before I was diagnosed, my friends knew I was very up and down and depressed and sometimes manic anyway. So my friends were my main support network other than my family, so I used to speak to them a lot. They weren't really surprised, they were quite supportive. My family was very supportive as well, but I ended up having a quite rough relationship with my parents because my mood swings were very volatile and sometimes I could become aggressive as well. I was 14, I was near the end of year 9 at school. I had probably the worst breakdown I've ever had, and I attempted suicide 3 times in the space of 2 days, and it ended up with me being admitted to an adolescent psychiatric unit. I was there for 2 months. It was really horrible, but it did make me a lot stronger. The medication I was on for bipolar, I tried many different medications, most of them didn't really work for me, and the ones that did work, the side effects became so horrible that it wasn't worth being on them. So about 6 months after coming out of the psychiatric unit I was on no medication at all, and I spent 4 years being unmedicated. I didn't have therapy, so I managed it on my own. I have come to terms with having the disorders that I have. I think it does make life a bit difficult, but I know that I can manage. Most of the time I feel a lot better, but the disorders are still there and sometimes it's still really hard, but I can always get through it. Anyone experiencing a mental health disorder, I would say just don't give up, because things are always going to get better. No matter how you feel at the moment, it will get better. And do go and seek treatment. It might be frustrating at first, not every treatment is going to work for you, but you have to persevere and find the one that does work for you, because there will be something. And make sure you have the support network of friends around you if you can, or your family. It really isn't spoken about enough, and it's a massive problem because a lot of people don't know a lot about it, and 1 in 2 people will experience a mental health disorder at some point in their lives, and 1 in 3 people will experience depression at some point in their lives. One of the main reasons why it's so important to be aware of the signs and symptoms of a mental health disorder is that you can't see mental health illness. It's for the most part completely invisible. If you look at the people around you, you would never know who might be suffering on the inside.